Hello, my name is Autumn Miner, and my mentor is Dr. Rhonda K. Lewis, and my research project is on examining adverse childhood experiences among college students and a comparison of a Midwest sample of substance use patterns to national trends. The adverse childhood experiences, or ACEs, affects both children and adults. In 2016, 34 million children ages 0 through 17 had at least one of 9 ACEs, and more than 20% had 2 or more. When it comes to adults, more than 60% reported having at least one ACEs, and 25% reported having 3 or more. The ACEs are trauma that has happened before the age of 18. The ACEs are tested by screening or surveying based on negative experiences in a child's life related to their care and upbringing. These questions in the ACEs only pertain to the first 18 years of life. The screening asks questions about physical, emotional, or sexual abuse, physical and emotional neglect, exposure to domestic violence, and the screening also asks questions about household substance abuse, mental illness, parental incarceration, separation, and divorce. My research questions consisted of what were the overall ACE scores of college students in a mid-sized college campus. Was there any differences in white and non-white within the ACE scores? And what was the substance use rates among the local sample compared to the national sample, and did they differ in any way? For my methods, we used a survey that consisted of 80 questions. The survey included demographic questions, help-seeking questions that were open-ended, and the adverse childhood experience questionnaire. Our participants included 115 college students located in a mid-sized Midwestern campus. Of the 115, 73% identified as female and 25% identified as male. When examining the ACEs, about 27% of participants reported having no traumatic events during childhood. 60% of participants reported having between 1 and 4 traumatic events, and 13.5% reported having 5 or more. When examining this table, the differences in the amount of substance use and gender from the local sample is comparable to the national trends in some areas. When comparing the substance use rate of any use in the last 30 days of the study, the national trends are higher in both marijuana use and e-cig use. But when comparing the substance use rates of any use within the last 30 days of the study, for tobacco, the local was the same as the national, and alcohol was higher than the national trends. According to the data, Wichita State University students have a higher rate of alcohol use than compared to the national data. Alcohol is allowed on WSU's campus, but it is not allowed in dorms, flats, or any other housing on campus. However, it can be served on campus at games, at Shocker Grills and Lanes, and can be requested for events, as well as there are several other establishments around campus that can sell and distribute alcohol. Regarding our adverse childhood experiences that were reported, our sample showed nearly 60% reporting having between 1 and 4 ACEs. This sample reflects what has been shown in the literature. Although 27% reported having experienced no traumatic events, 13.5% reported having experienced 5 or more. This is an important finding for our counseling and prevention services, or CAPS, to know, so that prevention and intervention can be designed. The alcohol use rate in this sample was higher than the national norms, and the trauma experienced by the sample are on trend with existing literature. Though there is more research needed to understand the connection between these two factors. Our limitations consisted of the lack of representation of males and minorities. There was an issue at the beginning of the survey, and 16 participants had to be removed. The survey was not a standard survey, although we did use a standard mode for the ACEs portion. We also wondered if there was a social desirability issue. In other words, did our participants tell the truth in reporting their actual substance use? Were our male participants younger than our female participants? And because this would explain why our female use was so high. An analysis was not conducted to determine whether there was an age difference in our males and female participants. In the future, we would like to make the questioning process more personal by using focus groups. This would give us a better chance to ask questions, rephrase questions when needed, and possibly get more personal answers when asking open-ended questions. Having the survey out longer may help with gaining a bigger or a larger sample. Perhaps conducting a randomized survey and targeting a sample with more racial and ethnic backgrounds will improve the outcome of the white and non-white aspect of the study. In conclusion, the adverse childhood experiences affects both adults and children. Trauma in your first 18 years of life increases the risk of substance use, domestic violence, and mental health issues, as well as other issues. It is important to practice prevention and intervention when it comes to risk and protective factors. For example, setting some policies or increasing CAP services may reduce the amount of alcohol being used on campus, as well as helping students cope with trauma that has been experienced. These are my references, and I'm open to questions. Thank you. When I began the study, so this is secondary analysis on another study that I did, and I had a lot of data from the first study. And so when I first started this project, I wasn't really expecting to find so many adverse childhood experiences within our students. And when I did get the data, I was just so surprised how many of our students are suffering from traumatic events during childhood. And it was just a really big shocker to know that there was a lot of other students that were suffering from mental health issues, substance abuse, and other risky behaviors. And so it confirmed something that I wasn't ready for. So. Well, I would like to expand on this research. It's very interesting to me. I've used a lot of this data for 2 years now, and looking at it, it just kind of concerns me about the amount of childhood experiences that people go through. That increases your risk, and I did state in my limitations if there was a social desirability issue, and that could be very well for people who have experienced traumatic events as well, not just substance use. It's a passion to to work on substance use and try to help that community as well. And mental illness is a real big issue as well, and people get stigmatized from it. And so I hope to do more research and better those communities and improve how people view them.